As part of the domestic services team, cleaning our hands in the right way, at the right times, is one of the best ways we can help to stop the spread of infection in healthcare environments. The most important things to know are how to clean your hands and when to clean your hands. If your hands are visibly clean, alcohol hand rub is the quickest and easiest way to keep your hands clean and safe while you're working. You'll find alcohol hand rub by each bedside and at key points throughout the ward. Before you start work, take off any wrist jewellery, watches and rings with stones or ridges. These are hiding places for germs. If you have cut or broken skin, cover the area with a waterproof dressing. Using the proper technique every time you clean your hands is essential. It means you don't miss any areas where germs might stay. The way you might clean your hands at home or social hand washing is fine outside a healthcare environment, but may not be thorough enough to stop the spread of infection at work. This demonstration, using an ultraviolet gel, shows how much of the hand is left uncleaned after normal hand washing. This diagram shows clearly which parts of the hand are most frequently cleaned and which are left uncleaned by social hand washing. By following the same technique every time you clean your hands at work, you can be sure that your hands are safe and you are not risking the spread of infection. If your hands are visibly clean with no soiling, apply alcohol hand rub using this technique. Apply a small amount of hand rub in a cupped hand. Rub your hands together palm to palm, spreading the hand rub over your hands. Rub the back of each hand with the palm of your other hand with your fingers interlaced. Rub the back of your fingers on the opposing palms with your fingers interlocked. Rub each thumb clasped in the opposite hand using a rotational movement. Rub the tips of your fingers in the opposite palm in a circular motion. Rub each wrist with the opposite hand. Wait until the hand rub has evaporated and your hands are dry. Don't use paper towels. The process should take 15 to 30 seconds. If your hands are visibly soiled or you think they could be significantly contaminated, clean them with soap and water instead of alcohol hand rub. The technique for using soap and water is the same as for the alcohol hand rub. Wet your hands with water. Apply enough soap to cover all surfaces of your hands. Rub your hands together, palm to palm. Rub the back of each hand with the palm of your other hand with your fingers interlaced. Rub palm to palm with your fingers interlaced. Rub the back of your fingers on the opposing palms with your fingers interlocked. Rub each thumb clasped in the opposite hand using a rotational movement. Rub the tips of your fingers in the opposite palm in a circular motion. Rub each wrist with the opposite hand. Rinse your hands with water. Use your elbow to turn off the tap. Dry your hands thoroughly with a single-use towel. The process should take 30 to 40 seconds. Being seen to clean your hands at the right times also greatly increases patient confidence in our commitment to preventing the spread of infection. Alcohol hand rub is always available nearby wherever you're working. It's at every bedside and on walls throughout the ward. It's a quick and easy way to keep your hands clean and safe as you work. Always clean your hands when you enter and leave a ward using the hand rub next to the door. Clean your hands too when you have all your equipment ready and you're about to begin work. There are 3 key moments when you're working in a patient zone or bubble when it's particularly important to clean your hands. These are: before you enter the patient zone, when you leave a patient zone or move between different parts of a bay, If you've come into contact with blood or bodily fluids, in this case you must always wash with the soap and water method. A bed space has a number of high-touch surfaces that pose the greatest risk of contamination. It's important to clean your hands with hand rub as often as you can between these areas. This is really important because contaminated surfaces increase the risk of cross-infection. One of the benefits of alcohol hand rub is that you can clean your hands while you're on the move, walking from one job to another. So, if your hands are visibly clean, use alcohol hand rub at the right times, following the correct alcohol hand rub technique. If your hands are visibly soiled or highly contaminated, use soap and water, following the soap and water technique. We can make a huge difference in the fight against the spread of infection by cleaning our hands in the right way, using the right techniques at the right time, and encouraging all our colleagues to do the same.